Sickle Cell Disease, or SCD, is a series of genetic red blood disorders that affects the characteristics of red blood cells, which carries oxygen throughout the body. In someone who has SCD, the red blood cells become rigid and look like the crescent-shaped farm tool called a sickle. This can cause severe pain, organ damage, dangerous infections, or stroke. Sickle cell disease affects millions of people throughout the world and is particularly common among those who have ancestors that come from sub-Saharan Africa, Spanish-speaking regions in the Western Hemisphere, such as South America, the Caribbean, and Central America, Saudi Arabia, India, and Mediterranean countries such as Turkey, Greece, and Italy. An estimated 1 in every 5,000 babies are born with sickle cell disease. In this video, we will learn more about sickle cell disease by discussing causes, signs and symptoms, the diagnosis process, and treatment and management practices. Sickle cell is an inherited disease caused by a defect on the hemoglobin gene. Hemoglobin is the protein in red blood cells that carries oxygen from the lungs throughout the body, and the gene instructs the protein to function properly. This condition deforms red blood cells to look like crescent moons, causing blood flow to be slowed or blocked. Sickle cells also die quickly, rendering the impacted individual's body unable to properly deliver oxygen to important organs and body parts. An individual is affected by sickle cell disease when they inherit 2 mutated genes from their parents. If only 1 mutated gene is inherited, then that person has the sickle cell trait. A person with the sickle cell trait can pass it on to their children. There are also other standalone traits that, when combined with the sickle cell trait, can cause sickle cell disease. Signs and symptoms of sickle cell disease become apparent before a baby turns a year old. Sickle cell disease is a thumbprint disease because it tends to vary for each person. It can evolve over time. Most symptoms result from poor blood circulation or depleted levels of oxygen in the blood. Some common signs and symptoms include anemia, resulting in a person feeling dizzy, short of breath, and fatigued. Episodes of pain, especially in the chest, appendages, abdomen, and joints. Swelling of hands and feet. Delayed growth or puberty. Vision problems. Jaundice or yellowing of the skin, eyes, and mouth, frequent infections, and stroke. All babies born in the United States are screened for sickle cell disease during the newborn screening process. A blood test will be used to definitively diagnose the condition. Currently, there are no universal cures for sickle cell disease. The only cure for sickle cell disease is a bone marrow or stem cell transplant. But these surgeries are risky and can result in death. Therefore, the procedure is typically reserved for those who have severe complications with SCD. Additionally, some other treatment/management practices exist, but are not limited to blood transfusions and medications to control and manage pain.
Hi, my name is Tawana Williams, and I am a mother of a child living with sickle cell disease. Our family has been through chronic transfusions, a splenectomy, and many pain crises. Yet, if I had to sum sickle cell up into 6 words, it would be painful, challenging, frustrating, encouraging, courageous, and yet filled with many blessings. I watch my son push past his limits to persevere daily, and yet we live by "you make the disease, don't let it make you."
This video is brought to you by PathCT and funded by the New England Regional Genetics Network, NERGN. We would like to thank Tawana Williams for her help producing this video. In addition, we would like to credit the Center for Disease Control and Prevention, CDC, the National Heart, Lung, and Blood Institute, Medline Plus, the Mayo Clinic, and Johns Hopkins Medicine for the information shared in this video. We would also like to thank Stephen Cofrancesco for composing original music for PathCT. If you'd like to stay in the loop, subscribe to our YouTube channel and follow us on social media, where you'll get updates on future episodes and other programs. Thank you.